Hello everyone. I'm excited to share a video from the panel I had a chance to participate in earlier this year. It was with FutureCite and it was called Opening Doors, Future Work Opportunities. This conversation is especially meaningful right now as we all are living through a very exciting but also challenging and interesting time with all the changes with tech and AI, and all of us are asking the same question. How do I stay relevant in this world? How do I keep my career going, my inspiration going? And I hope this conversation gives you a little bit of perspective and maybe a little bit of inspiration for your career path. We talked about different aspects of AI and how the workplace is changing, but I specifically spoke about communication skills because I worked in a very regulated field in healthcare where communication skills are not going anywhere anytime soon. So I share that piece after this video, and of course you can find the full video, full version of the panel discussion on the FutureCite website and their social media channels. I hope you enjoy the video.
And those are not easy questions to answer because we do live in an exciting era of AI and technological progress, but I do believe firmly that communication skills will not be lost with AI. I think the need for communication skills will be amplified with technological progress that we're making right now. And I do believe in that because I work in a very regulated field in healthcare where communication between healthcare professionals, between healthcare professionals and patients, between large corporations and patients and healthcare corporations will continue to be a center of attention. Because I do think AI can replace a lot of technical aspects of the work, but AI, as of today, cannot replace the human-to-human connection and the human-to-human interaction. So I would say, first important point I want to make that we will probably live in a world where interpersonal communication and ability to communicate effectively will be like a luxury. Because it's one thing to spend time in front of the screen with your LLM, with ChatGPT, with AI agent, and you think you know everything, and you think that agent or LLM model knows everything. But it will be a totally different world when you go out and talk to someone and you're trying to send your message and persuade them or be empathetic, or if you want to understand them properly, or they need to understand you for whatever reason. So I think that's the main point I want to make, that we will not move away from communication skills. We will actually have to work on them more in the future. And it will be a new type of luxury. And the second point I want to make, when it comes to sales and marketing, especially in healthcare, I think selling something or trying to bring something to market really takes a certain skill set, because you need to break down something complex and communicate it in a simple way to the person or to a business that will use your product, and you need to be able to send that message in the most efficient way possible. And I think that's something that everyone needs to be aware of, and everyone needs to work on their skill set, regardless if you work in marketing and sales or you don't, because it's just, to me, it's a simple and basic skill, and yet not many people spend enough time on developing that. When you need to take the complex product, break it down, and make the message that you communicates value of that product easy to understand for whomever you are trying to send that message to. So in healthcare, it adds even an extra complexity to all of what I mentioned. In healthcare, you're also dealing with patients. You're dealing with someone who is in the most vulnerable state possible. And being able to talk to healthcare professionals in a way that helps them to do their job better, to work with patients, to achieve their goal. The ultimate goal of every healthcare professional is to help their patients and make their life easier or cure the disease, whatever. And you need to make sure you can truly understand that, and not just bringing the technology to them, say, hey, I have the shiniest thing ever, I have the best AI-powered technology on planet Earth, and you need to use it. We have the best algorithm, we have the best model, we have the best statistics on something. It's the wrong message to send, because I think it removes the understanding of the real world that health professionals are living in. And that's where, again, communication skills come very handy. You really need to understand the person, you need to understand what you are selling and why you're selling to them. So I hope that kind of answers the first part of your question, Eva, that communication skills is something that we all need to work on. And it's so easy nowadays to forget about them, because, again, we have so much data, so much information that comes with AI and technology. But being able to communicate your message, communicate the value, is very, very important.
So I have a quick question on that first question. I know you were teaching courses at several universities. What were the challenges or questions or problems that you were helping the students solve? Like, it sort of speaks to everything you're talking about. If you can give maybe an example.
Problems to solve. I teach my students to understand different stakeholders, and that, let's say you have one product, but you need to speak about that product to 3-4 different sets of customers and stakeholders, and they all have their own agenda. They all have different way of looking at your product, and it's your job to understand them first, listen to them first, and translate your message and hit the points that the person in front of you is looking for. For example, if you have medical technology or medical product, it can be AI powered device or software. If you're talking to a doctor, you don't really talk about all the data sets and all the technicalities. You really talk about the outcomes the doctor will see when they're using your solution, and how that specific tool, let's say, will help them to diagnose a disease. If you're talking to a nurse, you really need to understand that nurse, because you need to be able to tell the nurse that you will potentially save their time, but it's not going to replace them, because it's another aspect of it. But you need to tell them why it will make their job easier, and they will be able maybe to spend more time with patients that need them most, versus, spreading their bandwidth too thin among all the patients they have to take care of. If you're talking to a business unit manager, you're probably not going to talk about either technology or patient care. You probably will be talking about the financial aspect of why the solution will help the hospital or the hospital unit to increase efficiency, and where the finances will, whether or not the financial part of it will make sense. So that's what I teach my students, to really understand who they're talking to and why. Because I do find that students, when they look at something, they usually look at features, they look at the technical aspects, but they don't really break it down to those components to understand why they're talking to those people and what's their stake in the game. It goes back to that empathetic storytelling. I think that's what you were mentioning. Like, the empathetic storytelling plays a big role, especially in healthcare. So the biggest gap that I see so far with introduction of AI is that we talk about technicalities more, and we forget about that empathetic storytelling. And I think that comes from the background of people developing those high-tech solutions. They most of the time, they sit in their offices and they're writing code, and they're communicating mostly with computers and each other. And they go too far in the technicality of things, and they forget about the the reality of healthcare, as I mentioned, when doctors and nurses and technicians, they spend their days working with sick people who are struggling, need to help them. And I think that gap of translation of that technical awesomeness of the technology that someone is developing to someone who really needs to be so empathetic, feel the pain, serve the patient, and do their job very well. Like, that's where the gap really is. And I think from the sales and marketing perspective, that's my job, to translate that and have that empathetic storytelling be a big component of what I do. So I'm not there just to sell something. I'm there to understand and to, again, send my message across the best way possible. And the cross-functional collaboration, that's part of the question that you asked. That's another big gap that we see right now, where communication skills really need to be, I don't know, rediscovered, maybe redeveloped. When the person, for example, like me, I have to be able to talk to different sets of people and bring them together in a project. And to give you an example, I had one project where we were introducing a brand new technology to hospital, and I was working on the company side. I was working with the business unit, of course, and also with software development group, product development group. And we were bringing it to the hospital to a group of nurses and doctors, and we had to pilot the product. And I remember when I brought to that project, I was brought to that project relatively late. So some communication was already happening. And when I started observing the way how people were communicating, I saw that there was a huge, I would say, huge gap in what was going on. The technical people, they didn't listen to the nursing staff. And I think nursing staff couldn't really explain enough what they were looking for from the development team. And company was bombarding nurses with a lot of presentations and a lot of features, why this product will work very well, why this feature works, this feature works, and this feature works. And I remember when, after some time, the project was not moving fast enough, I reached out to a couple of nurses and I had one-on-one conversation with them. And I realized that they were never told what it means to their day-to-day workflow, what it means to them to bring that product and put it on patients, and how that will help them. They were always bombarded by technicalities, by how beautiful this whatever screen we will see on the interface we're going to see, but nobody really talked to them, and nobody really asked for their pain points, and they were scared actually to use that technology. But they were scared to tell us that. They were actually against the technology because they thought it will take away their work. So there was such a miscommunication and such a misunderstanding that was happening for probably a couple of months. So we actually had to start from scratch. I had to go and actually talk to different groups separately and then bring only a few people from each group together just to have a bit of a round table to really truly share the fears. The new technology is always scary, and I think Jillene covered it very well in terms of the change management. It's always scary. And we need to be able to have safe space to talk about it, and companies need to acknowledge that. They need to admit that, yes, there is risk. Yes, there might be bias. Yes, there might be a problem, but we're here to help you. We're here to learn from you. We're here to spend time with you to understand your needs, versus here we are, we're the best, we have the best thing ever, we've developed the algorithm, is awesome. It doesn't mean anything to a nurse who cares for patient day to day. I just wanted to share maybe a couple of conversations I just had recently. I had a communication with one of my students yesterday. I had a question about AI and what do we do if AI makes a mistake? Let's say we're talking about AI powered device, or maybe a software in a clinical setting. And what if there's a mistake? Who is in charge? Who's responsible? Is it AI, or is it a doctor? Is it a nurse? And I think it's a very common question that we see and we will be seeing more and more. And this is what I say, that we still put the most liability, I would say, on healthcare professionals, and the ethical judgment is still in their hands. I do think we need to stick to that as long as we can, even though there are some people like Elon Musk who claims that in 5 years, robots will be performing, AI will be performing surgeries and doctors, surgeons will no longer be needed. I still think we need to have that human component and ethical judgment that would make the final judgment call. Because I do think, and also having clinical background myself, medicine is not black and white. It's not math. And I feel like people behind technologies, because they usually have that not science, but technical math background, they see world in a very black and white way. And medicine is not. Sometimes it's up to doctor and nurse to make that final call based on even sometimes small signs that are not maybe being considered by AI algorithm, and they need to make that judgment. So I do think we need to have human in the loop at all time, and as long as we can, because the biggest lesson that I learned from my experience selling medical technology is that you are selling not just the technology, but you're selling the trust, you're selling the feeling of being heard and understood versus just the technology. I don't think anyone will buy, or hospital doctor, nurse will buy, make a decision to buy something purely on technology basis. They can understand that it can benefit them, but they also buy with the notion that the company who built it has their back. And as we all know, right now we live in an interesting world where companies are trying to kind of push away liabilities and say, well, AI didn't do it, didn't do that. I think it will create even more issues with trust.